Diagnostic procedures for CAD, coronary artery disease. CAD means there is atherosclerosis of the coronary artery, supplying oxygen and nutrition via blood stream towards the heart muscles. So the blood examination, that is called as lipid profile test, in which total cholesterol, high density lipoprotein, low density lipoprotein, triglycerides, these are the types of fatty material and the cholesterol in the blood. So their estimation, calculation of the amount present in the blood is diagnostic process or the feature for the CAD. Various cardiac enzymes levels are increased in CAD, especially C-reactive protein. We also estimate the ESR, which is usually and mostly raised. Next is the ECG. This is a basic diagnostic process, that is ECG at rest, by which we record through the electrodes over the chest wall, and we visualize in the form of graph the electrical changes going on in the heart muscles and the conduction system of the heart. Next is the echocardiography. That is, in this process, sound waves are used to visualize the interior of the heart, chambers, valves, and the blood flow. So we can also visualize directly by this procedure, over the monitor or the video film. We can visualize the living activity of the heart from inside by means of the sound wave energy. Next is the simple X-rays. That is, we can estimate and judge the size of the and position of the heart, any swelling in the heart mass, and increase in the size of the heart. Next is the angiography. Angiography is the process by which catheterization is done. Catheter is passed via wrist or the groin vessels and is passed, that is, the dye is infused through this catheter, which passes in the heart chambers and also in the coronary arteries. And exterior is the high power X-ray machines, exposure of the X-rays that produces the scans or the X-ray films, and also the video of the anterior of the heart, coronary artery, their position, their obstruction, their changes in the walls. All these can be visualized and can be transformed into the film, or we can also record the CD. So this is the most important, the diagnostic procedures nowadays used. Before, especially the surgery of the heart, that is the placement of the stent and the cabbage surgery. As we know, the main cause of the CAD is over use of the saturated fat, sedentary habits, lack of normal exercise, then especially the stress and depression factors, they also influence the heart activities. Then is the diabetes, hypertension especially, and next is the genetic factor. In certain cases, the patient suffer from the abnormal gene transmitted from the parents, and there is a familial predisposition of the disease. So these are the main factors, in addition to the self-made factors, that is the smoking, alcohol, excess may be used for. Next we can do, that is called CT angiography, angiogram. In this is a non-invasive procedure in which we don't pass catheter and the dye directly into the heart chambers and the vessels. But in this case, the dye is introduced directly, infused into the blood, and then the X-ray films are taken and study over the monitor that can be easily performed by this process. So angiography angiogram and the CT angiography angiogram, they are the main diagnostic process imaging procedures before the performance of the heart surgery.